We have done a series of studies with Everolimus in neuroendocrine tumor, beginning with small single institutional studies and then leading to the larger multinational, multi-center radiant studies. Well, we observed that patients with genetic cancer syndromes in the mTOR pathway develop neuroendocrine tumors. That's really what led us to develop this series of studies that show that their activity for Everolimus in neuroendocrine tumors. Well, back in 2011, we completed RADIANT-3 and showed Everolimus was active in pancreatic neuroendocrine tumors and got the drug approved for that group of disease in 2011. There's a big gap in terms of treatment for non-functional tumors. These tumors tend to be a little bit more aggressive. They grow a little bit faster, diagnosed a little bit later, and survival shorter. And that's the motivation for us to see where else Everolimus can really contribute. Well, the somatostatin analog, where it's really shown to be active is in patients who are treatment naive or mostly stable. And there's a large group of lung neuroendocrine tumor where there's really no drug really showing activity in terms of being able to stop the tumor growth. So there's still a lot of unmet need, which this study fulfills. This study, which we compare Everolimus to best supportive care and placebo, we showed an improvement in progression-free survival from 3.9 months to 11 months by central radiology review. This essentially is a 52% reduction in the risk of disease progression. And that's really the primary endpoint of the study. We also showed there's a trend toward improvement in overall survival at this very early first interim analysis, but we'll be continuing to follow the overall survival once the data matures. I think it definitely offers a new treatment option for patients where there was really no treatments available, especially in the lung group and in patients with non-functional tumors that are progressing. Well, I think we're beginning to see an era where we have more treatment options available. Everolimus, our plan is to essentially present these results in the peer-reviewed literature as well as seeking health authority approvals. I think this year we have a very good year in neuroendocrine tumors. We have a number of phase 3 studies showing significant activity. And Everolimus here really has now demonstrated broad activity across a wide range of neuroendocrine tumors in lung, in pancreas, as well as in the gastrointestinal tract. And that's really the first of its kind in terms of treatment in neuroendocrine tumor that demonstrates such a wide-ranging activity across the different sites.